I'm Errol. I'm co-founder at Cedar, and I run our makers organization. Consumers are increasingly demanding better digital experiences, and COVID-19 has only accelerated that trend. I think we can all agree that the financial experience is not really on par with what consumers expect. When I go to the doctor, I have no idea how much I'm going to pay. I have no idea if I'm going to get a bill or not. Every financial interaction is fundamentally a surprise to me. As a healthcare leader, I would want to think about how I reinvent that experience to rebuild a more positive, trusting relationship with my patients. Every time a patient has a single encounter with a healthcare provider, they receive communication from many different parties. You get a communication from the health insurer, you get a communication from the provider, often multiple providers associated with that single visit. Healthcare organizations that have invested deeply in improving their patient financial experiences have seen a win-win. Their patients are actually happier, and that can be proven with survey feedback. And they've also seen improved financial results. They actually make more money because patients are more willing to pay their bills, and their administrative costs are lower because patients call in fewer times or have fewer issues in the billing cycle. Revenue cycle leaders need to rethink the way that they're communicating. They need to start by measuring to understand what's working well and what's not working well. And then they need to find the right technology partner. There are a few key pillars that you need to think through when finding the right technology partner. You want a technology partner who really has a modern consumer engagement platform. Patient financial engagement platforms are designed to constantly iterate, to learn what the optimal way is to engage with each patient, given their own unique circumstances. So rather than thinking about this as a fixed set of rules, send a statement to a patient once a month at a fixed interval, what you really should be thinking of this as is instead a dynamic system that you can configure with certain constraints and will automatically learn the right way to engage based on every unique patient's pattern of behavior. When selecting a patient financial engagement platform, it's vital to think about the holistic patient journey from start to finish. Before a visit, you need to accurately set expectations with the patient about what their financial responsibility may look like. Prepare them for that in ways that really aren't scary, that are fundamentally positive and trust-building experiences. After a visit, you need to make sure to message a patient what their cost actually was in a way that will make sense to them, that's easy to understand in a way that a modern consumer would expect, which means not calling someone on the phone, rather being able to resolve something automatically through a digital workflow. Cedar has reinvented the way that healthcare technology engages with consumers. What we've done is we've taken best practices from the digital marketing world, where they've figured out the exact right way to engage with consumers, optimizing everything from the variant of messaging to time of day, to exact right way to communicate with every individual user. We've taken that approach and we've adapted it to the world of healthcare, to use it to improve the way that healthcare providers communicate with their patients and drive better outcomes for both the patient and the healthcare provider. A successful implementation should result in three things. Number one, improved customer satisfaction. You should actually see patient experience survey feedback improve. Second is that you build longer-term relationships with your patients. You should see that through improved retention metrics. And the third is that you should see improved financial results as well. By helping to improve the patient financial experience, you should actually see improved resolution rates for bills. Patients will be more likely to pay their bills, and they'll be happier.